Hello everyone, today we will discuss about the pathophysiology of hypertension. In most people with established essential hypertension, increased resistance to blood flow accounts for the high pressure while cardiac output remains normal. People with pre-hypertension or borderline hypertension have high cardiac output, an elevated heart rate and normal peripheral resistance, which is termed as hyperkinetic borderline hypertension. In later life, cardiac output falls and peripheral resistance rises with age, leading to development of essential hypertension. It is not clear whether or not vasoconstriction of arterial blood vessels plays a role in hypertension. Hypertension is also associated with decreased peripheral venous compliance, which may increase venous return, increase cardiac preload, and ultimately cause diastolic dysfunction. Pulse pressure, which is the difference between systolic and diastolic blood pressure, is frequently increased in older people with hypertension. This can mean that systolic pressure is abnormally high, but diastolic pressure may be normal or low, a condition termed isolated systolic hypertension. The high pulse pressure in elderly people with hypertension or isolated systolic hypertension is explained by increased arterial stiffness, which typically accompanies aging and may be exacerbated by high blood pressure. Many mechanisms have been proposed to account for the rise in peripheral resistance in hypertension. Most evidence implicates either disturbances in the kidney salt and water handling, particularly abnormalities in the intrarenal renin-angiotensin system or abnormalities of the sympathetic nervous system. These mechanisms are not mutually exclusive, and it is likely that both contribute to some extent in most cases of essential hypertension. It has also been suggested that endothelial dysfunction and vascular inflammation may also contribute increased peripheral resistance and vascular damage in hypertension. Interleukin 17 has garnered interest for its role in the increasing production of several other immune systems chemical signals thought to be involved in hypertension, such as tumor necrosis factor alpha, interleukin 1, interleukin 6, and interleukin 8. Excessive sodium or insufficient potassium in the diet leads to excessive intracellular sodium, which contracts vascular smooth muscle, restricting blood flow and so increases blood pressure.